herniated disc or slip disc go back to normal? Now, if you have ever had a disc issue in your spine, this is probably one of the commonest questions that gets asked. And the answer to this question really depends on what is the type of problem that you have with your disc and how severe it is. So in this video, I'm going to explain to you in very layman languages, like in very simple English, what exactly happens, what is a disc firstly, and what happens when you say there's a slip disc, the different stages of slip disc, and then how your recovery is dependent and going back to normal is dependent on what is the stage of your disc prolapse or your herniated or slip disc. Okay, so if you've ever gone to the doctor with a disc issue or say the severe back pain that you get with disc issues, and he's given you a diagnosis saying you have a prolapsed disc or you have a herniated disc or you have a slip disc, it can be quite overwhelming. And these different terminologies actually are referring to the different stages of a disc problem. So let's get into the details of this. But before we do that, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. So basically, I help moms of younger kids who work in high stress executive jobs manage the aches and pains that come with their motherhood journey. So basically, if you have any spinal, that is neck and back, or joint pains that started during your pregnancy, childbirth, or the years after, this is where I come in and help you manage these aches and pains with simple exercises, tips and tricks, hacks, little things that you can change within your daily lifestyle or your daily activities. And these little things add up to bigger changes. And yeah, if you're a mom who doesn't have time to include all this into their daily routine, that is where I come in and I teach you how to squeeze them in without taking out a chunk of your time. All right, so going back to the topic for today, can a herniated or a slip disc go back into its place? So, what is a disc? So, if you did not know, in your spine, which is made up of vertebrae, between every two vertebrae, there is a jelly like structure that is present. It's like a rubbery, gelatinous material that's present. It's known as a disc. So, it is a shock absorber, so that say when you are jumping and you have that bone, the one vertebra that lands on top of the second vertebra on the below vertebra below, so there is like a little jelly squishy material between the two vertebrae, so they don't sort of go bone on bone. Or any activity that you're doing, even if you're sitting for a long time, these discs are the one that are protecting your spine by giving that cushioning effect. So they also provide that little space between your two vertebrae for the nerves to be exiting the spine from the sides. Anyway, we're not going in so much into the nerve part. Let's focus on the disc for today. If you're looking for more with nerve radiculopathy or nerve pain, you can look into my YouTube channel. And I have done quite a few videos there. So if you go onto YouTube and you type in my name, Swati Prakash, followed by nerve pain, it'll come up with a couple of videos that you can watch. All right. So going back to the disc. So what happens is sometimes this disc can move out of its place. Now, we're not talking a complete movement. However, what can happen is if you look at the structure of the disc, there is the middle of the disc, the central part, which is a jelly like structure. It's quite on the liquidy side, and the outer part of the disc is made of this fibrous material. Okay, so what happens is if you need an analogy, okay, how do you say that, whatever, if you need an example, you can look at a single fried egg. So you have the white part of the egg and then you have the yellow yolk in between. If there is, you take a knife and there is a cut, you make a cut in the white part of the egg, the yellow yolk runs out. If it is a small cut, the yellow liquidy yolk of the egg will just come to the probably the outer edges of the white, but it's not going to run into your plate. If the cut is bigger or thicker or deeper, the yellow part of the egg is going to run out beyond the white part. Now, let's shift this same logic to your disc. If you have a tear in the outer annular part of the disc, what happens is the middle gelatinous part or the jelly like part of the disc tends to run out. If it is still contained within the material of the disc and it hasn't completely run out, this is known as a protrusion or a slip disc. Slip disc is a very general term that people loosely use, but in medical terminology, if your doctor says you have a protrusion of the disc or you have a protruded disc, this is what he means, that it is still contained within the, if this is your disc, it's still the jelly like material still contained within the fibers, but it is not coming out of its place. However, if the tear in, if this is your disc and the tear is bigger, what happens is this jelly like material will flow out and it's sort of peeping out from here. This is known as a prolapse. Now, if this prolapse goes further and that jelly like material comes out to quite an extent, it's known as an extrusion. The next stage, and probably the most severe stage, is when that jelly like material of your disc goes out completely, and that is known as a sequestration, which, of course, your doctor will tell you to fix it surgically if that can be done. So, the extrusion and sequestration, the last two stages, the third and the fourth, are also known as a complete slip disc. Whereas the first two stages, where your central jelly materials is just about coming out and prolapsing out of the area, are known as an incomplete slip disc. So if the reason I'm telling you these terminologies is if your doctor uses these terms with you, you would probably have a better idea of what's happening within your disc. Now, if your disc material is coming out of its place, so the second, third, and fourth stage, it is possible that they are irritating the nerves in that area, and then you get this nerve pain. So, again, I'm not going into the nerve pain, but I'm just telling you that this can happen. Now, going back to a question of whether the herniated disc can go back to its normal, our bodies are very resistant, yet they're very delicate, right? So, what I mean is they have this healing mechanism that is in action all the time. However, once you get an injury or a change in the structure, it is possible for your body to recover. Even if it's possible for your body to recover 99.9%, usually it'll not go back 100%. But if you can function without that change in the body going back to its 100% original function, who's complaining, right? So we can still work, walk around, do whatever we were doing. So usually it is possible in the first, I would say, one or two stages, depending on how bad the problem is and what are the other medical conditions you have, what is the condition of your spine. So there's a lot of factors that it depends on. Depending on that, usually people can recover if they are careful with their posture. If you've known me for more than 2 minutes, you know I talk a lot about posture, but hey, this is relevant here. Okay, so if you do not load your spine repeatedly when you have the slip disc issue, or if you are careful about your posture, you're careful about not bending forwards a lot, because usually that is the aggravating factor in with slip disc. So if you're following all the precautions, if you're doing the treatments, doing the, you know, you're following the do's and don'ts, usually you can recover, but as I said, usually not 100%. The last two stages depends. Well, the very last stage of sequestration, mostly it's surgically fixed. But the stage of extrusion, it depends on how extruded your disc is, how much out of its place it is. All right, so that sort of gives you an idea. I know there's not a black and white answer, but there's a lot of gray area. So it is very the answer to this question of can a herniated disc go back to its normal position is a very gray area, and it depends on your specific condition. So your doctor would be able to advise you better on this. All right. So if you're looking for more solutions, simple solutions to manage your back pain or neck pain, you can join my free community. I will leave a link in the description of the video. If you're watching me on Instagram, the link is in my bio. You can click there, it'll open a new page, and just scroll down. It says my community. You can join from there. If you have neck pain, there is a free training that I'm doing this month, in the month of March. And it is on simple solutions to manage your neck pain, where I do cover the disc issues as well, and nerve pain as well. So have a look at that, and you're welcome to join the community. The training and the community are completely free. If you're watching this video sometime in the future, the training lives in the guides, in the well, in the walls or the guide section of my community, so you can access it at any time once you join. Alrighty, I hope that answers a few questions. I will go and do a couple of more videos in the subsequent days on disc issues. So if you have any specific questions that you want me to address pertaining to disc issues or back pain or neck pain, leave your questions in the comments below, and I'll be happy to pick it up from